I think one of the big questions that women ask, okay, I'm going to take this breast implant out. I don't want another implant put in, but will I have enough breast volume after my implants are removed? Or am I going to end up like completely deflated?
Right. So yeah, that's a very common question, and especially in the line of the types of surgeries that I do, I get that question a lot because the vast majority of what I do is removing implants, and majority of those patients actually have that concern because they got implants in the first place. A lot of times for that reason, they did not have a lot of volume to begin with, and now here we are. The implant has to come out, and now they're back to their original volume. And is that going to be enough? Are they going to be happy? There's a couple factors that we discuss when we look at this question. One of them is, in general, most women have a little bit more breast tissue as they get older, and there's a couple of factors that I think influence that. Number one, most patients gain a little bit of weight from head to toe, and some of that weight does settle in the breast as well. So some patients are a little bit pleasantly surprised that after the implant came out, oh wow, that's actually a little bit more volume than I thought. The other, there's some hormonal changes that actually take place, especially after breastfeeding, after childbearing, certainly after menopause. A lot of women report that they have a lot of glandular hypertrophy, a lot more breast volume than they had before these things happen. So, some of that time just plays in our favor that there's a little bit more volume. Typically, though, what happens after implants is that volume gets splayed out over a larger surface area, which is to say, when a patient has an implant in or gained a little bit more weight, then the breast footprint grows in response to that. So then, with the implant, the breast footprint is lower and maybe wider. So whatever tissue they do have is spread over a larger surface area and therefore less projected centrally. So what we end up doing once we remove the implant, obviously the lift is sort of the best way to gather up all that tissue into a smaller footprint, but therefore more projection. And then the part of that we talk about when we talk about auto-augmentation is that we really want to optimize that opportunity and not waste any breast tissue that we possibly can. So classic lift techniques actually don't necessarily carefully consider how much breast tissue we can sort of salvage, so to speak, from different parts of the breast in order to bring it together. What an auto-augmentation techniques do is they really look for anything that can be used and rearranged into an overall nice shape and preserved in order to give us as much volume as possible.